Okay. Hello. Good afternoon, everyone. Thank you for joining us on our first Friday event in May. Our title is Mind Your Mental Health with Workplace Implications. My name is Alan Todd. I'm the site manager at the Detroit Grand River office with Michigan Rehabilitation Services. Ms. Ebony Orr will be taking care of all the questions towards the end, and we will be providing the last 15 minutes for Q&A. And with that, I would like to introduce Mr. Dr. George Paris, who will now be facilitating the event. Thank you.
Good afternoon, everyone. As Mr. Todd said, my name is Dr. Paris, and I am happy to be doing this presentation today. Obviously, this is Mental Health Month, and the topic, Mind Your Mental Health, actually comes in handy with what's going on, with people's mental health, especially since we had the COVID-19, seems to have been high increase in mental health issues, not only in the general population, but also what we've noticed is increase in mental health issues in the workplace as well. So I'm going to spend the next 45 minutes trying to focus on some mental health issues within the workplace, seeing that it's a really big phenomenon, right now. The American Psychological Association just did a survey that was just released 2023, a survey, and it shows a really high increase in mental health issues in workplaces. So this is something that people are trying to grasp, to understand what are some of the issues that are affecting and promoting mental health issues, within the work environment. So I want to focus on that. Just give you a quick background of who I am. For those of you who don't know me, I've been a psychologist for over 20 years. I've been doing assessments and mental health therapeutic training, organizational developmental training for the past 20 years, plus from a variety of topics, including workplace mental health, trauma-informed care, organizational development issues such as emotional intelligence, implicit bias training, so forth and so on. So I come with a vast amount of knowledge and background. And for those of you, again, go green. I got my PhD from Michigan State University. So no harm to maize and blues, but we bleed green, so go green. Okay, so let's go in. Let me start off with some objectives first before I start with the presentation. So what I want to capture today is give you a good sense of understanding mental health. What do we mean by mental health? And what is considered a mentally healthy individual or person? What are some of the prevalence of mental illness in the workplace? Workplace mental wellness, what do we mean by that? How do we understand the issues of mental health within the work environment? And what are some of the mental health first aid or areas that people can address to assist them in coping with stresses and adversity, and challenges at work? And so I want to really focus on that because what tends to happen is that people are dealing and facing a lot of issues at work from a mental health perspective. They don't talk about it, and they end up going off work or on sick leave because of depression, anxiety, so forth and so on. So I want to capture some of the areas that people can address, that they can look at and try to deal with it and, and assist themselves. And we're going to have a conclusion. And part of the conclusion is we're going to leave about maybe 10 to 15 minutes for questions at the end of the presentation. What do we mean by mental health? Well, based on the World Health Organization, health is a state of physical, and when we talk about physical, we mean how you feel physically. It's mental, how you feel emotionally, and it's social well-being. How are you interacting within your environment, your family, your friends, and so on. So it's merely the absence of disease or infirmity. When we talk about mental health, mental health is a state of well-being. Again, when we talk about well-being, we're talking about how is an individual able to cope with normal stresses of life? How are they able to understand and realize their own potential, their own abilities? Can that individual work, productively and fruitfully? And can that individual also make a contribution to his or her environment? So when we talk about mental health, what I want you to start thinking about is mental well-being. Mental health has to do with well-being. It doesn't mean because a person has a mental illness, they don't have good well-being. You could have a mental illness and still have good mental well-being. So it's two different things when we talk about mental illness and mental well-being. Mental health disorder, on the other hand, again, it's not an exact science, but it's a term we use to try to indicate what we mean by mental disorder. It's a clinically recognized symptom of behaviors which causes things such as distress in how the person is feeling, how they're functioning, how they're coping. How does this distress interfere with the individual ability to function, from a personal perspective? And also, how does it interfere with this individual being able to function from a personal aspect within, the confines of the family, within a work environment, within a social environment? So it's not just an issue where the person is not doing well emotionally, but how is it affecting? People could be doing not well emotionally, but can still be functioning well within their community, within their workplace, within their social, a construct, within their family. It's when a person isn't functioning well, that's when we talk about mental health disorder. And so, those are two different things. Mentally healthy individual functioning and a person with a mental disorder, it means that that disorder is interfering with their ability to function effectively in all aspects of their lives. And so creates an adversity for them, it creates a dilemma for them where they are unable to function effectively and manage their day-to-day circumstances in a way that they can be productive and healthy. What is mental illness like? Well, I want to make sure you capture this, right? I like to think of mental illness like any other forms of illness. We have physical illness, people have cancer, people have asthma, people have hypertension, diabetes. Well, mental illness to me is, although we look at it from a mental perspective, it is still like a physical illness because it interferes with your ability to function effectively. Those thoughts can be, can become so complicated that an individual ability to function within their society can be damaged. And so it's not something where we don't have the willpower or we don't have the drive or the ability to function well. It's an illness. And so when I look at mental illness, I'm looking at it as a broken brain, right? So it's like telling a person who, who has an amputated leg, you have to walk across the room or run across the room. Well, that person is going to take time. They may have to use crutches, they may have to use a walker, whatever the case is. But that person is not going to be able to function the way they, I would have been able to function if they had two normal legs, if I can say that. So a person with a mental illness has what I call a broken brain. And that broken brain impacts their ability to function in a normal way. And so what I want people to grasp is that it has nothing to do with willpower or your understanding of how you cope. If you have trauma and that trauma affects you, it's going to affect how you cope. If you have trauma and that trauma, interferes with your, mental capacity to think and to understand things around you, it's going to affect how you cope, how you function, how you deal with adversity. So trauma is one of the number one issue that leads to people having what I would call a broken brain, because trauma, we know from research about 80 to 90% of all persons diagnosed with a mental health issue has some form of trauma that is impacting their ability to function well. And so when you look at, for example, kids coming out of foster care, we know that 65% of children in foster care tend to develop PTSD, a post-traumatic stress disorder. So again, we know people are coming from abusive relationships, people are coming from unhealthy childhood, people are coming from environments of poverty. All these things contribute to mental illness, which affects the brain and affects how those individuals function in the long run. So there's a mental health continuum. We talk about maximum mental health, and look, I don't think that anyone really have maximum mental health. We try to function as best as we can within the environment we're in. No two individuals have the same lived experience. So when we are dealing with people, when we're interacting with people, we are interacting with people based on that individual lived experience. And that person's lived experience is going to affect how they function and how they cope. So when we're interacting with people, one of the things I want people to gather and to start thinking about is to always have this empathy level to say, this individual that I'm interacting with, what has been their lived experience? What has been their life circumstances? How is their lived experience interfering with their ability to function effectively? And so that's one of the things we're looking at when we talk about maximum mental health. And so, we have maximum mental health, how that individual is functioning. People can have a diagnosis of serious mental illness, but they can be coping well. They can be coping well. They can learn to cope. They can learn to deal with adversity. So again, going back to what I started out by saying, not because an individual has a mental illness, it doesn't mean that they're unable to function well, right? They can still be functioning well because they've learned coping mechanism, coping strategies that's giving them that ability to function effectively. And so a person could have, what I would call a minimal mental health, but they could be functioning very inappropriately because they did not learn how to cope well. They did not learn how to deal with adversity or to address challenges when they're faced with those challenges. So part of it, again, is looking at mental health along a continuum from minimum mental health to maximum mental health, to minimum mental disorder to maximum mental disorder. What do we mean by those type of things? And again, going back to a few previous slides, when I talk about mental disorder, I'm talking about how is your mental health impacting your ability to function effectively. That's what we mean again by mental disorder. So a person could be diagnosed with a mental illness, but they could have maximum mental disorder, or they could have, what I would call a minimal mental, disorder. What are mental health problems? Well, mental health problems, as I mentioned, is how that illness affects the individual, how it affects that individual's ability to think properly, to deal with adversity, to deal with challenges. For those of us who work in the field of vocational rehabilitation counseling, we are fully aware that one of the things, or one of the big challenges that we face every day with our consumers, our clients, is that when our clients have some form of mental health issue, how it affects them in being able to maintain a healthy living lifestyle, whether it's being able to function well in school, function well at work. Well, they're going to have challenges. If we don't teach them coping skills, if we don't understand how their adversity or trauma is affecting their ability to function, that person is going to fail if we just put them in a setting to work without really getting a grasp of how that trauma or whatever that issue is affecting their ability to think, their ability to cope, their emotional state, their behavior. how that is disrupting their ability to work and carry out, daily activities of living, whether it's personal relationships, whether it's social well-being, whether it's being able to function effectively at the work site. And so again, one of the things I always urge people to look at or challenge people to look at when you're dealing with people and you're trying to place them into a work environment is to understand how is that individual's mental health affecting their ability to cope and to function and to work effectively and to deal with challenges and adversity on a daily basis. Now, what I want to move to is, again, some of the prevalence of mental illness in the workplace. And this is really challenging in terms of, I don't think people really grasp how severe mental illness affects the workplace. So one of the things I want to focus is on a little bit of stats. It says 84% of workers experience at least one mental health challenges within the last year. That's a lot. And when we talk about mental challenge, it could be stresses at work, whatever those stresses are. It could be people having stresses in their personal life, and those stresses are interfering with their ability to function at work effectively. So when you are bringing stresses from your home environment into the world of work, it's a challenge because it makes working more of a challenge to that individual. It makes interacting with your coworkers and your superiors more challenging because you're probably anxious. You're probably going to be feeling away, and any type of stress is going to affect your ability to communicate effectively with your coworkers, with your superiors, and it's going to lead to other areas that is going to affect your ability to function effectively at work. 71% of working adults also report at least one symptom, of stress at work, within the past year. Again, these are these are things we need to look at because again, these are not low numbers. These are very high numbers within the workplace, and it's how it's affecting individuals and their ability to cope and function effectively at work. This statistics really is, from my vantage point, it's really striking. 68% of millennials and 81% of Gen Zs left their jobs for mental health related reasons in the last year. Let me repeat that. 68% of millennials, 81% of Gen Z. So people are leaving work because of stress. People are leaving work because of mental health related issues and how it's affecting them and their ability to cope effectively the workplace. And so these are things I think that we have to look at and consider when we are addressing mental health issues at the workplace and its impact on workers and on employees in terms of their ability to function effectively and to be able to do the job well. 38% of employees feel comfortable using company-related health services. So again, when people are feeling ill at work, one of the things we notice is that they're not taking advantages of the type of resources employers are offering to help them. And so this is where I think supervisors and managers, and administrators need to make sure that they're in touch with their employees to make sure that if they're not feeling well, and if they're not, we have to talk to people. We have to let them know these are the resources that the company is offering that can assist you in being able to function well and to being able to deal with the challenges that you're facing at work. We don't want people having stresses at work and not dealing with it effectively, and it becomes something that they tend to hide and keep, and then they have an explosion. We do not want that. We want people to be able to feel comfortable, that they can talk about their stresses that they're feeling at work, what are some of the challenges that they're experiencing, so that we can give them some type of guidance and assistance in helping them to cope and to be able to deal with those stresses effectively. So let me give you some more stats. There's 1 in 6 people experience mental health problems in the workplace. 12 billion working days are lost every year to depression and anxiety. 12 billion working days, folks, right? Happy employees are more productive. I mean, we know that, right? So if an employee is happy, they're much more productive at work. If an employee feels satisfied with their work status, with their work environment, if they don't feel that they have a toxic work environment and the culture at their work environment is encompassing and it's exciting, you look forward to coming to work every day, people perform well. In fact, what research shows is that people actually perform better and do more when they feel happy at work. And again, people are spending 1/3 minimum of their day at work. Whether they're working, remotely, whether they're working at the job site, people are spending at least 1/3 of their time that day at work. So we want people to be able to feel a sense of that they belong. And if people feel that they belong at work, it decreases the stress levels and increases productivity. What do we mean by workplace mental wellness? Workers who feel that their identity and perspective are valued by leadership report higher rates of psychological safety. That's just, to me, it's common sense. But as I say, common sense is not common sense to everyone. But that's a fact, right? If you feel good at work and you feel that you are accepted, you have a healthy work environment, yes, there's going to be much higher self-satisfaction, less stress, and you're going to feel good coming to work. Workers who feel psychologically safe in their work environment, that is strongly correlated with fewer bouts of stress and other issues contributing to mental health concern, right? So again, feeling safe in your work environment, feeling that you belong in your work environment, wanting to be at your work environment contributes to you having a sense of well-being that decreases the stress level, that decreases the anxiety-related issues, and increases your mental health. And so part of that is when we talk about workplace mental wellness, that's what we want workplace to portray. Third, workers in a healthy work environment tend to report experiencing fewer microaggression related issues that are focused on gender identity, and I can add things like, implicit bias, racial issues. All those things become part of a good workplace. If a workplace has healthy environments, those microaggression or microaggressive tendencies tend to diminish when people, regardless of race, regardless of ethnicity, regardless of culture, regardless of gender, issues tend to feel more accepted and accommodated at that work site. And as a result, less stress, healthy work environment, better employee. Workers who do not feel that leadership values and respect their identities perceive their organization as part of the problem, right? They look at those organizations as complicit in creating a harmful or cultivating a psychologically unsafe environment. So we want people to feel safe. And So if the leadership values that individual, values their identity, values their concerns, values, and listen to them. I think one of the biggest thing I find when I do a lot of training with employers, all over all walks of life, when you value what people have to say in an organization, it increases that psychological safety. It gives people permission to talk. It gives people permission to say to you, I am not feeling well. I am not doing well. I need help. And so people tend to talk more. They tend to be engaged, and they tend to be able to express themselves in a way that lends themselves to decreasing stresses. Workers in unhealthy work environments obviously will report much more psychological distress and mental health concerns. So that's a given. Again, just some quick stats again. In 2022, 81% of workers report that workplace stress affected their mental health. 73% of workers report that workplace stress affects their relationships, not only at work, but with family, with friends, that social environment or social interaction. Look, these things are not compartmentalized. If you are not doing well in your home environment, you're going to take that to your work environment. Vice versa. If you're not doing well in your work environment and you're having stresses at work, those stresses are going to be seen in other areas of your life, whether it's with your family, your friends, your community. It's going to affect all walks of life. People are not good at compartmentalizing, especially mental health issues, and keeping it just in one place. If your mental health is affected, it's going to cross boundaries. It's going to be in all areas of your life. It's going to affect all aspects of your life and how you function, how you cope. The 2023 Work in America survey, again, I'm trying to just give people an impact so that they have a real good understanding of how mental health is prevalent and how the perception of workers are seen. So workers reporting toxic workplaces. So here's the percentage of workers describing their workplace as toxic. All right. So we have current work environment and we have type of work environment. So on the current environment, we can see 13% of people who work remotely say, although they're working remotely, they still complain that their work environment is toxic. 18% who work hybrid, 22% who work in person. The type of work where people report, their workplace tends to be toxic. Office work, 14%, manual labor, 21%. But what's very surprising to me is when you look at customer, client, patient services, 26% of those individuals report that their work environment tends to be toxic. So environments that I would call, and again, environments that are supposed to have empathy and caring and empathic understanding, that those are the workplaces that seem to be workers, seem to be sane, seem to have this perception, and perception is reality to that person. And that those perception is within those environments, 26% of those individuals are reporting their work environment be toxic. Again, the same survey shows that toxic workplaces are associated with diminished psychological well-being. And again, here's the other, graph that I want you to see. Percentage of workers reporting mental health concerns. Again, the blue is healthy workplace. The red is toxic workplace, workplaces. So again, agree employer thinks workplace is mentally healthier than it is. 49% compared to 77%. Work has negatively impacted mental health, 28% healthy, as opposed to 76% think that the workplace is not healthy. Have poor mental health, 21% healthy, 58%, said the workplace obviously is toxic. Again, not good mental health. Have experienced harm to mental health at work, 15% says are healthy. They haven't experienced any harm within the workplace, as compared to 52% who is complaining that they've experienced harm in their mental health at work. So again, these are figures from the American Psychological Association. These are new 2023 figures that came out. A huge survey that they did. And again, these are surveys that are being reported now, again, less than just a few months ago, that we're seeing that since COVID. Now, the question people may ask me is workplace mental health increasing because of COVID? Because of it? Well, it could be, we don't know. But again, this is something I want you to be aware of. Again, I'm not going to go through all these stats. We have, these are all mental health survey issues. 500,000 people every day are away from work due to some form of mental health stressors, injury, illness. 1.23 million people say they have been harassed at work, which obviously leads to mental health issues and mental health complications, mental health disorder. And so these are figures that we need to be aware of. Mental health obviously has gained a lot of, people are talking about it now. It's a big thing. We're seeing it at work. We're seeing increased violence at work. We're seeing increased aggression at work. We're seeing increased disrespect of people at work, whether it's employee and employers, whether it's employee and supervisors or co-workers. So we're seeing an increase how the workplace is contributing to increase toxicity, increase mental health issues, and therefore it's increasing pressures at all levels. So we need to have a good understanding of mental health at work and what we need to do to contribute good, non-toxic work environment. And when we talk about a healthy workplace, we're talking about a psychologically healthy and safe workplace is a workplace that allows an employee to be able to basically be themselves, to be able to communicate without repercussion, to be able to be able to talk about their needs, to be able to talk about how that workplace is affecting them. What are their likes? What are their wants? What are their needs? What are their dislikes? And all those things lead to well-being. Now, what I always say to workers, you can talk about things that are affecting you. Yes, your employer should listen. Your employer doesn't always have to agree with you, but I think it's important for employers to listen to employees, to help them to be able to focus, to be able to help them to decrease stressors, to be able to help them to cope with challenges and adversities, and to help them to be able to start acting in a way that's going to be beneficial, not only to that individual, but to the organization as a whole. So we want people to be able to function well. As it says in the last bullet on this slide, if unaddressed, the impact of mental health problems due to people staying away from work because of illness as a result of mental health problems is going to cost business over $198 billion in the next 20 years. That's a lot of business money, business losing, right? Because we want to make sure we know that there's about 30% of all claims and disability claims are related to mental health, right? So how can we avoid the high, enormous amount of claims that employers are facing as a result of people taking time off work because of depression and anxiety and substance use disorders and other related mental health issues like aggression and stresses that are creating adversity and challenges for that individual to cope effectively at the workplace. Right? So factors leading to unsafe workplace, job demands and requirements that are maybe not, I don't want to use the word appropriate, but job demands that maybe go beyond what the work requires, and job demands that maybe are not explained well to employees so they understand what the requirements of the job is and entails, and modeling to help them to be able to do the job effectively, job control or influence over what you're doing, employees not being rewarded or recognized for effort. Everybody is not going to be, an A. Just like in a school environment, everyone isn't going to get an A. Everyone is not going to be an A+ student. But can we recognize that B student and say, good effort, good try? You can do better next time. So that's the same thing employees need. How do we recognize employees for their effort? If they're trying and their effort and their commitment, can we recognize them? Can we give them credit? Can we praise them? Fairness in the workplace. Fairness in all aspects of life is essential, but especially within a work environment. Are we treating all employees the same? Are we treating some employees differently because of the way they work, or we feel that they're better workers? No, fairness and support is essential to a healthy work environment, to creating a non-toxic workplace in terms of employees can work effectively and be able to deal with challenges and adversities when faced with those challenges and adversities. So we want workplace. So these are things, again, high effort, low reward, high demand, low control. Unfairness equals strain or stress. So again, if people are given effort and there's not reward, if people have high demand and have no control over how they function within that work environment, and if they're seen or think or perceive that there's a level of unfairness within that work environment, it's going to lead to mental health issues such as stress, such as substance use, and other things that's going to occur that's going to affect them. Workers who are not getting the help they need. 78% of full-time workers do not seek treatment, right? Only 48% of employees disclose, when they have issues at work that are mental health. They don't talk about it. They don't feel comfortable. They don't trust their co-workers. They don't trust their leadership. And so they're not discussing it. They're not getting the type of help that they need. And we all know that the longer a person stays off of work because of mental health issues, the least likely they're going to come back at an adequate time, or if they come back, they're going to keep going on and off work consistently because they're not addressing the issues well, and the environment is still the same. So if the environment doesn't change, you're not going to change that person's ability to not have a mental disorder and function effectively within the work environment. Some of the areas of mental health concerns, these things that depression, anxiety, some of the mental health crisis, aggressive behaviors is increasing at work, as I said. Substance use is increasing. A lot of suicidal thoughts. We do, one of the things I do a lot in organizations is incident, management, because we see suicidal ideation. We see attempts of suicide and risk behaviors that lead to those type of things, panic attacks at work. And so again, a critical incident stress management is something I do a lot because we see it's prevalent in the work environment presently, and it's something that we're addressing continuously within different employers and environments. So psychological safe workplace, prevention, promotion, guidance, right? What can we do to create a healthy work environment? How can we promote health and wellness awareness within the work environment? Do we have wellness meeting? Do we have, and again, do we have stress days? for our employees. And I can say, as an organization consultant, I have gone into many organizations, and I'm proud to say that I have been fortunate to been able to get leadership to offer mental health days to their workers, because and they've seen benefits from it, that those mental health days are essential in reviving and recharging employees, and helping them to be able to function better. So those are things, and guidance, talking to your employees, making sure that employees understand what's going on, and employees talking to each other. Talk to your coworkers, get guidance from them when you're facing stresses. What did I do? How would I deal with certain situations? So not only leave it up to the employer, but you can talk with your coworkers as well to get some input in terms of how you can cope with stresses and challenges at work on a daily basis. So we talk about mental health first aid. I'm not going to spend much time on this, because basically mental health first aid is really observing your coworker. What is going on in that work site? If you see a coworker isn't doing well, do you just leave them alone, or do you talk to them and say, hi, June or Jade or Jim, or John, I've noticed that, you're not talkative today. I've noticed that you're in your office today, and you haven't opened the door. Is everything okay? Is it something that we can talk about? Be interactive with your coworkers. Know your coworker. Understand who they are. If you see changes, or they come in the morning and they're not the same type of person, jovial, enthusiastic, happy person you know them to be, you want to talk to them and see if there's something going on that you can assist them, that you could talk to them about, because you wouldn't believe, maybe just saying hello and talking to them could be just the start of that person being able to explain or talk to you, or cry with you, or just get your comfort in terms of what is affecting them. Because there's a lot of stigma. There's a lot of stigma still associated with mental health problems, whether it's in the general society or at work. People don't want anyone to know that they're struggling mentally. And so they don't talk about those struggles from a mental health perspective. So it's essential for people to understand that when we talk about workplace mental health, that understanding your coworker, understanding your employee is essential in helping to minimize stresses, and to help them to talk about any type of challenges or adversity that they're facing at the work site. Mental health first aid: assess risk, suicide or harm, listen non-judgmentally, give that person reassurance and information, encourage that individual to seek professional help, and encourage self-help strategies, right? We talk about, we cannot, especially in our field, ladies and gentlemen, we cannot only be the ones to be given. We sometimes need to have people to talk to. So understand what we mean by compassion fatigue, right? There's a difference between compassion fatigue and burnout. Burnout is when, I always say to people, when you are at the stage of burnout, you need to find another job. Because burnout is when that job offers you nothing that you want. You are going to be angry with your customers. You're going to be angry with your coworkers. You are not going to like anyone, including yourself. And so when you are at the stage of burnout, and you don't like that job anymore, that's time for you to say, maybe I need to be doing something different, and this is not for me. But compassion fatigue, that's different. That's when you're giving a lot of yourself, and you may need some help yourself to deal with the trauma and the issues that you're facing every day from your consumers, as well as the environment you're in. And so it's a series of psychological and emotional factors that contributes to you as a helper, as a counselor, as a person working within the healthcare field, not doing well. And so that emotional fallout from dealing with people on a daily basis and hearing and listening to people's stresses is also traumatizing to you. And so get some help, talk to people, deal with those challenges, deal with that adversity, how it's affecting you. Don't take it home. Talk to someone. Don't make it leave your work site and affect your personal life outside of work, because then it becomes a cyclical thing where it's at work and home and your community, and it's not helping you nor anyone that is associating themselves with you. Recognize the more prolonged exposure you have to people who are traumatized, you are likely to expose yourself to trauma. Working long hours without, you have to have boundaries. Every one of us need to have boundaries. When do we stop working? Don't carry your work at home. Personal demands at work, at home, and all those things are affecting us. The more isolated you allow yourself to become at work, the more impactful it's going to affect you long term in terms of how you cope with adversity. It's going to increase your, your vulnerability and your ability to deal with stressors effectively, and it's going to affect you. So understand that. Well-being improvement, pace, safety, autonomy, goals, support. These are things we need. These are the 5 pillars of well-being at work. All of us need space. All of us need psychological safety. To some extent, we need autonomy. To some extent, we need to understand what are our goals at work. Why are we at work? What are we here to do? And are we meeting our goals? Are we getting support to accomplish our goals and to reach our targets? So those are things that helps to improve our well-being. Connect with other people, folks. Do not be isolated. Social well-being is about connection. Be active, exercise, do yoga, do jiu-jitsu. I do jiu-jitsu. So do some type of activity that contributes to your well-being, that helps increase your physicalness and how you cope. Learn new skills, developmental well-being, right? Challenge yourself to learn new things every day. Read, whatever. Pay attention to the present moment. We call that psychological well-being. What is going on with me now? What is occurring presently in my environment? Whether it's at work, your community at home, how is that affecting me? What are the consequences of what's going on? And so pay attention to the here and now, to the present moment. Give to others. That's emotional well-being, right? Help your co-workers, help your community, help your leaders, give advice, give feedback to your supervisors, your managers. It's not only your managers and supervisors to give feedback to you. You can also give feedback and advice and suggestions to your peers as well as to your leaders. So it's a, it goes hand in hand. It's all about the 5 pillars of well-being, how you cope at work. And to conclude, develop positive relationships with your colleagues. Know your colleagues. Watch out for each other. If you see a colleague in distress, reach out to them. Don't let them suffer. Talk to them. As I said to you before, develop your own self-care plan. Work is not just about coming to work, helping others, and going home. What are your self-care plan? Do you have someone that you talk to? Do you have a mentor? Do you have someone that you can say, you know what, this was my day. How would you have dealt with this situation? Or, or I just need to talk to someone, just to debrief, just to get a moment, right? Spend plenty of quiet time alone. It's essential. I know in this day and age, it may be hard. We have kids, we have our TV shows, and everybody's busy, but you know what? That quiet time, it recharges your batteries. It helps you to think. It helps you to have your moment alone. Hold one focused, connected, and meaningful conversations each day with someone, whether it's a coworker, whether it's a leader, whether it's a mentor, a friend. Have somebody that you can talk, right? Have somebody, even if it's once a week, that you can connect with someone. If you can connect with your peers outside of work, and so you can talk, you can laugh, you can feel free, you can talk about the challenges and give each other feedback. I would recommend that as part of dealing with compassion fatigue, as part of dealing with stresses from work, handling those challenges every day that you need. So, ladies and gentlemen, I hope this was beneficial to you. I hope I was able to touch on a lot of things. I know I did it very quickly, but I was trying to get as much information to you as possible so that you can learn, so that you can understand the gravity of mental health issues within the work environment and how it's affecting each and every one of us, and how we should be able to cope and learn strategies to deal with this on a daily basis so that we can have psychological well-being and function as healthy human being and have the most optimum quality of life at work as well as outside of work. Thank you very much. I appreciate MRS for asking me to do this. And as I said, I hope it has an impact on each and every one of you. And I look forward to doing more of these type of presentations with you and everyone else. So thank you kindly. Thank you very much. And I'm now open up for questions.
Okay, thank you, Dr. Paris. That was very good and very informational. So we do have several questions in the chat. I'll try to get through as many as I can because I know we're pressed for time. But I'll start with the first. An individual said, I agree. We have to talk with people. Dr. Paris, do you believe a person can still be affected by the trauma and sudden change of their daily routines from COVID?
Absolutely. Absolutely. Look, COVID has lent itself to a lot of isolation. Think about the 2 years that people were working from home without no contact with co-workers, without no contact with in many cases with friends, and even family. So that trauma alone that some of us acquired from being away due to COVID and the impact that alone had on us, and then coming back to work and not really addressing those issues that we had to deal with as a result of COVID, but now coming back to work and having additional stresses and trauma affecting us. On top of that, it's enormous. And so these are challenges that are occurring at the work site daily, occurring at the work site minute by minute, hour by hour, and that is compiling on the trauma that we are already coping and not coping with, but dealing with and not addressed effectively after COVID. Many people after COVID didn't get counseling. Many people after COVID did not seek help. And in fact, many employers didn't even think that how COVID would have affected their employees to really provide them with counseling or training or workshops to help address those issues. So people are back to work with trauma and still trying to work effectively in an already trauma, maybe infected environment or an environment that is not psychologically safe. And that is definitely going to affect how you function and cope, and it's going to lead to burnout, not compassion fatigue. That's going to definitely lead to burnout and you maybe quitting your job or having a mental health issue or breakdown.
Okay. Next question, or more so statement, someone said the 26% customer client patient services is not surprising to me. Majority of my coworkers feel overwhelmed, overworked, and unvalued.
Well, I even think that number, I really think that number is probably higher. I think people have a tendency, although they may not be doing well, this social construct, especially when we're filling out surveys, We want to be correct. We want to be appropriate. And I think sometimes when people are filling out surveys, they're not really answering questions truthfully. So I think that 26% is probably much higher because I think, like I said, I do a lot of workplace screening. I talk to employees, and even when I do my own surveys in workplaces, I find that number is much higher that I get from employees, and in talking to them, that their workplace is not helping them and they're not doing well in that environment. And that's why you find out in a lot of workplaces now, there are a lot of conflicts occurring between employees as well as between employees and employers, and it's not a healthy situation.
Okay. Lisa Duncan asks, will this PowerPoint presentation be available for us?
I can definitely make it available. I will just have to know who to send it to, and I will share it with uh, whoever is the leader within MRS that would like to share with you. It can be available to everyone, definitely.
Okay. Next, statement or question is, recognizing effort is not praising a person or group, and within the same statement, the little yet powerful word "but" is used. That small word nullifies anything said prior to.
Well, this is where I think it's a challenge. I think one of the things I always try to say to co-workers and employers, both groups, is try to be as transparent as possible. To me, transparency is the ingredient for psychological safe environment, work environment. If people are transparent within a work environment, it means that they have high levels of integrity, they're transparent. It really leads to people really understanding who you're dealing with and who what your leaders mean to you, as well as your co-workers. So I think when you say to me, if somebody is giving a praise, but then they say, but, yes, it does diminish that praise, because basically what they're saying is, I'm praising you, but you're still not meeting, or you're still, no, either you're praising someone, the but can be dealt with at a different time. The but doesn't have to be part of the praise. The but doesn't have to be part of the accommodations or the recommendations or the praise you're giving. You can talk about the issues after. So to me, if you're praising someone, you praise them, right? I've been a professor for 20 years. And one of the things I never did to a student, I never said you did well on your work and this was excellent. But no, if I'm giving them a praise, I'm gonna give them a praise. If I need to talk to them about areas they need to improve, that's going to be a different conversation. Let that person feel good about what they have done today. Let them feel good about what they've accomplished, and that's going to give them some incentives to even work harder. And so I can deal with areas I want them to improve at a separate meeting or a separate time, but I do not include the praise with remarks that's going to diminish that praise.
Okay, and it's 1:59. We do have two more questions. So if you want to take this last one, I can read it.
I
And then
definitely.
we can let Alan wrap up. Last question is, Doctor, do you think people in general are apprehensive to fully disclose due to retaliation? Any further thoughts?
Well, yes, absolutely. The research showed that I didn't put the new research that's done by the American Psychological Association, the 2023 survey, definitely shows that. A lot of people did say in that survey that they do not like to talk at the work site about issues affecting them because they don't want to lose their job, or they feel it's their perception, whether or not that's real with the employer, but it's their perception that if they talk about things at the workplace or give feedback, that they're going to be reprimanded, or there could be consequences that could lead to job loss, or that could lead to them not being promoted. things of that nature. So yes, this is something that the 2023 American survey shows broadly that many employees feel that they don't want to say anything because of reprimands or consequences that could occur as a result of speaking out. And so people are continue to work in an unsafe environment because they refuse to talk because they feel like there could be some negative repercussion from talking.
Okay,
Hello?
go ahead, Alan.
Okay, good. Thank you all.
Okay, I would like to thank our presenter, Dr. George Paris, for presenting. And I would also like to thank everyone for joining us this afternoon on our First Friday event. Thank you, everyone, and take care.
Thank you very much.